Thank you, Vivian. And last but not least, Bill Martin and drug policy.
I doubt anyone's going to decide how to vote in this presidential election based on the candidate's position on drug policy. But as the candidates, including some who have dropped out, have set forth their opinions, and as they have listened to the concerns of people who came to their gatherings, we can see that significant change is in the air. Now, because there are fewer differences, my slides are going to be somewhat simpler. Like 77% of American adults, all the candidates are at least somewhat open to medical marijuana, but like slightly fewer than half, they are opposed or uncertain about recreational use. Bernie Sanders does say, and is the only one who does say, that he would vote for legalization in Vermont. Dr. Ben Carson acknowledges that marijuana has proven to be helpful in at least some medical circumstances, but thinks it's a gateway to harder drugs and not something we want for our society, in part because it can make a person seem sleepy and listless. Donald Trump favors medical marijuana but opposes recreational use. As you know, he claims he does not drink, smoke, or use drugs in keeping with his ascetic nature. Hillary Clinton appears to have been relatively aloof from the counterculture when she was younger. Her college friends do not remember her smoking dope, dropping acid, drinking to excess, or tearing her pantsuit off at concerts. She has said that marijuana should be available medicinally for people with extreme conditions, but she wants to wait and see for the evidence in states that are legalizing it for recreational use before taking a position. Senator Rubio strongly opposes recreational use and criticizes President Obama's decision not to enforce all aspects of the federal law in states such as Colorado, Washington, Oregon, and Alaska, which have chosen to legalize. And he also wants to dispel the myth that President Obama doesn't know what he's doing. He knows exactly what he's doing about this. Donald Trump, Jeb Bush, Ted Cruz, Carly Fiorina, and Rand Paul all personally disapprove of legal recreational use, but they support the right of individual states to make their own decision. Even those who believe it ought to remain illegal for recreational use are open to some form of decriminalization. Keep it illegal, but lower the penalties. That does less harm to users, but it also lets criminals keep all the money. And Bernie Sanders points out that 90% of the income from drug trafficking goes to 1% of the cartel kingpins. It's rigged. All of the candidates recognize the problems drug abuse can cause, particularly for adolescents. But enthusiasm is waning for continuing the war on drugs in the way it's been pursued, relying mainly on strategies of eradication, interdiction, and incarceration. There have been exceptions. One of Ben Carson's top priorities would be to seal the border with Mexico to stop the flow of drugs and violence into the U.S., and particularly into neighborhoods and inner-city communities. And of course, Donald Trump wants to build a 2,000-mile wall to get Mexico to pay for it, which is a long shot. Former President Felipe Calderón said Trump is not a very well-informed man. Mexican people are not going to pay any single cent for such a stupid wall. A spokesman for the current president, Peña Nieto, said, "Of course it's false. It reflects an enormous ignorance for what Mexico represents, and also the irresponsibility of the candidate who's saying it." But most of the candidates agree with Bernie Sanders when he said, "We have to rethink the war on drugs, which has destroyed the lives of millions of people." Secretary Clinton believes we should stop imprisoning people who use marijuana, and urges more states, cities, and the federal government to address this. Carly Fiorina said putting people in prison for nonviolent drug-related offenses is not the solution and is clearly not working. Other candidates have also noted the need for sweeping change in sentencing and other aspects of the criminal justice system. You've heard Bernie Sanders say, "I find it very strange that a major financial institution that pays $5 billion in fines for breaking the law, not one of their executives is prosecuted, while kids who smoke marijuana get a jail sentence." Rand Paul raised awareness of the racial outcome of the war on drugs. He said, even though whites use drugs at the same rate as black kids, the prisons are full of black kids and brown kids. As for white kids and wealthy kids, not so much. The way marijuana laws are enforced, he said, discriminates against minorities and people at lower incomes. But, he says, hopefully, there are Republicans trying to correct this injustice. In 2015, Ted Cruz offered a detailed set of suggestions criticizing overcrowding of federal prisons due to drug crimes without evidence that it has enough effect on property and violent crimes to justify the human toll of more incarceration. He co-sponsored the Smarter Sentencing Act of 2015 that, among other things, cut sentences in half to give judges more flexibility in determining an appropriate sentence, given the circumstances and the individual. He subsequently reversed course and warns that letting federal prisoners out early will lead to an increase in crime. This switch is troubling to people who had admired his more enlightened attitude. A sad but serendipitous effect of this campaign has been that the first two states, Iowa and New Hampshire, are in the midst of a serious opioid addiction, both to carelessly prescribed legal pharmaceuticals and to heroin, which many turned to when the law cracked down on prescription drugs and heroin became easier to get and cheaper. Heroin-related deaths more than doubled nationwide between 2008 and 2013. Overall, drug overdoses now cause more deaths than motor vehicle accidents and firearms, with opioids like hydrocodone, oxycodone, and OxyContin, and other pain medications killing 44 people a day. At the first open meeting in New Hampshire, described in the New York Times, the first question asked of Secretary Clinton was not about the economy or health care, but heroin. She has since laid out a $10 billion plan to combat and treat drug and alcohol addiction over the next decade. At a 2-hour meeting in Laconia, person after person told of the difficulty of getting their children into treatment program or of losing a child to heroin. New Hampshire has about 100,000 people in need of treatment, but the state's publicly financed system can serve only about 4% of them. New Hampshire is second to last in access to treatment programs, ahead only of Texas. Many of Republican candidates heard similar stories and are sharing their own. Carly Fiorina told of burying a child dead of drug addiction and said, "We must invest more in the treatment of drugs." Jeb Bush, whose daughter has had serious problems with drugs, illegal and legal, wants to give nonviolent offenders proper treatment and reduce mandatory sentences so they can get back to their communities more quickly. And Governor Chris Christie talked about a friend killed by pain meds and released an ad in New Hampshire declaring, "We need to be pro-life for the 16-year-old drug addict who's lying on the floor of the county jail." These same issues will arise in Indiana, West Virginia, Kentucky, and other states with a serious opioid and heroin addiction use, and attendant rise in HIV and hepatitis C rates. President Obama recently traveled to West Virginia, a mostly white state with high levels of opioid overdoses, to discuss a $133 million proposal to expand drug treatment and prevention programs. Martin O'Malley, by the way, had probably the most comprehensive plan for treatment and prevention. It's worth noting that nearly 90% of those who tried heroin for the first time in the last decade were white. A majority were middle class and upward. That is significant because, to put it bluntly, white lives matter. White people have more clout with public officials and legislators. They're more successful in their attempts to recast addiction in a less stigmatizing light. Many parents and treatment providers are trying not to use words like junkie and addict instead using words that will imply or indicate a chronic illness, such as substance use disorder, and saying it ought to be treated as a disease or a public health problem rather than a crime. According to an article in the Times, more than 750 groups are now collaborating to create a national organization facing addiction, devoted to fighting the disease of addiction on the scale of the American Heart Association or the American Cancer Society. This is a positive development. No politician wants to argue that we should start locking up white people the way we have locked up brown and black people for a century. Drug policy may not be the issue that sways millions of votes, but this campaign at this time has forced politicians in both parties to think seriously about ways to meet the desperate need for more humane, realistic, crime-reducing, and cost-effective drug policies. May it be so.